Hi, I'm Dr. David McKalip, a brain and spine surgeon in St. Petersburg. Welcome to brainandspinecare.us, the website for my practice. I hope we can form a patient-physician relationship that will help you solve your medical problems as they relate to the brain or the spine. So here's a little bit about me. I'm a brain and spine surgeon. That's a neurosurgeon, also known as a neurological surgeon. That means that I trained after 4 years of college in medical school for 4 years, which I did at the University of South Florida in Tampa. And then I did 7 years of residency training in neurosurgery at Chapel Hill, North Carolina. After that, I had my first job in San Francisco at the University of California, San Francisco, where I was the co-director of neurotrauma, conducting research in academics, which meant the laboratory and clinically. I've been in private practice in St. Petersburg since 2000. I'm a board-certified neurological surgeon. My practice is a private medical practice, which means my first concern is you. In my practice, I pride myself on spending time with you, the patient. There are many practices that are more like a mill or a factory. Patients sit in the waiting room by the dozens, wait to be called, and then maybe after an hour they're seen. They get rushed in and see a nurse or an assistant who spends most of the time with the patient. Then the doctor makes an appearance, maybe shows them the scans, or tells them what they saw, and offers an operation. That's not how my practice runs. When you come to my practice, you're going to fill out some paperwork which stays completely private. I'm going to go over your symptoms with you then. I will spend 45 minutes of my time with you. Most of that time will be one-on-one, asking you questions about your symptoms and examining you. Some of it will be me looking at your scans before I show them to you. After examining you and asking you questions about your symptoms and your medical history, I will then show you your scans. We will go over them in detail so you understand any findings that are on those scans. Many times patients will come into my office and say, "Well, doc, haven't you seen the MRI? That shows you everything you need to know." The MRI or the CAT scan are important, but they're not as important as your symptoms. So when you sit down with me, I'm going to ask you, where does it hurt? How long has it hurt in that spot? Has it changed recently? Are there things that make it feel better? Are there things that make it feel worse? And we're going to come up with a diagnosis based on that, your examination, as well as your scans. And I think patients are surprised because so many times the doctor will just stick their head in the room and say, "I saw your scan, you need an operation, let's schedule you in 2 or 3 weeks from now." Well, again, that's not how we do things here in my practice. I want to listen to you, and I want to find out what your symptoms are and direct my treatment to those symptoms. Because in the end, it's really what you're feeling that we're trying to fix, not what happens to be seen on a scan. After we've talked and gone over your medical history and symptoms and shown you your scans, we will then go over your options. Maybe your best option will be to do injections with a pain management doctor, putting some steroids around a nerve that's inflamed or a joint that's inflamed. Maybe your best option will be to do physical therapy and work with your doctors using some medications. Maybe your best option will be an operation, and we'll talk to you about that operation in detail. We'll show you what happens during an operation. I will also make sure that any surgery I do is the smallest operation possible. I'm not interested in doing an operation that you don't need just so I can make money. I'm interested in doing the operation you need that gets you better as quickly as possible. So here at my practice, I put you at the center of my attention. We're going to come up with a plan together that will make you happy, a plan that will focus on your symptoms and get you better as quickly as possible. Thank you very much for listening, and I look forward to meeting you in my practice.